Ear pain is one of the most common reasons we have visits to the pediatrician's office. There are so many different reasons why, from ear infections to a whole bunch of other causes. So let's review some of the reasons why children have ear pain and talk about the times they have to come in to be seen.
So anytime your kid is touching their ear, you're probably going to think they have some sort of infection or there's something going on. Like Dr. Jill said, there's many causes. It doesn't always mean there's an ear infection. Eustachian tube dysfunction is probably one of the more common reasons that we see in the office compared to an ear infection. That can happen if your child is teething, if there's any nasal congestion. Symptoms like that can cause a little bit of fluid to back up into the ear, which cause a little bit of dysfunction and sometimes some discomfort and pain. Ear infections are obviously another cause. If your child is having ear pain and there's discharge coming out, that's obviously something we should see them for. If it's just a couple days of ear pain, it might be worthwhile to give them some Tylenol or Motrin over the counter, see if that helps with the symptoms. You don't get ear infections from going underwater, but it can happen. You get a swimmer's ear from that, but not an inner ear infection. A swimmer's ear you can get from the outer ear canal if there's a little bit of like a superficial skin infection that can happen, cause a little bit of pain. But those are probably the three most common reasons that we see the ear pain.
Aside from somebody putting something in their ear, which we obviously recommend against.
Yes.
But we always have to look for things like that. One point about Motrin and Tylenol, unless your child can't take Motrin, after 6 months old when it is okay to take Motrin, it's an anti-inflammatory, which Tylenol is not. So if there's a severe pain, make sure you have ibuprofen, either generic ibuprofen, Motrin, or Advil, children's Motrin or Advil, and those will be helpful to help the discomfort in the ear. As PJ was saying, the eustachian tube connects the nose to the ear. That tube can get filled with fluid, and it can make a lot of discomfort for the children, especially when the fluid gets behind the eardrum and it bulges the eardrum out. That's where all the ear infection pain comes from. What we want to do with that is give an antibiotic, but we really have to see it. So a lot of the time people will say, can you just call in an antibiotic because I know he's got another ear infection? When in fact, that's not always the reason. We don't want to overdo antibiotics. So when we do say come in, it's not for any other reason except we want to make an accurate diagnosis.
Sure. And on the same note as the Tylenol and Motrin, your kid does not have to have a fever in order to give the Motrin or Tylenol if there is any ear pain. There can be just ear pain. You can give Motrin. It's not going to bring their temperature too low or anything like that.
And you can always call us because we can avoid a late night emergency room or urgent care visit if you do the right things, give some Motrin, even a warm compress, a dryer, the warm dryer on the ear, things like that will help children get through to the next morning where we can see them in the office.
Sure.
So it is something that's common, and it's one of the most common reasons for infection in childhood. So if you need to come in, please do. We're here every day. Take care.
Thank you.